In today's video, we're going to be talking about melasma. What is melasma? How do we treat melasma? What are the causes of melasma? And how do we prevent it from worsening or coming back? And lastly, I'm going to be sharing treatment options that can help you clear melasma on the face. Melasma is one of the most difficult form of hyperpigmentation to treat. I do have a series of videos on hyperpigmentation, so make sure you check that out. If you're new here, welcome to my YouTube channel. My name is Tahwah. I am a skincare advocate and an esthetician. I share skincare tips and product recommendations to help you achieve and maintain healthy, clear, glowing, and youthful skin. So if this sounds like something you will be interested in, then make sure you are subscribed and hit the notification bell so you know when I upload a new video. Right now, I try to upload a new video every Sunday, and I hope to continue to do that. Let's get right into it. What is melasma? Melasma is an island of pigmentation that appears in form of a patch. It is usually dark or brown patches, but sometimes grayish or bluish. It tends to apply around the forehead, around the cheek, mostly around the lips, sometimes on the neck. You can also sometimes get it on the arms, on the chest, and on the thighs. Commonly found on the face and on the neck. Now, melasma is one of the most difficult form of hyperpigmentation to treat. You do need to see a skincare professional or a dermatologist to look at your skin, do a proper skin assessment to actually conclude that what you have is melasma. You don't want to spend money, time, and effort treating melasma if you haven't seen a skincare professional that has done a proper skin assessment to confirm to you that you're dealing with melasma. Now, let's get into the causes of melasma. Melasma is usually caused by hormonal changes such as pregnancy, but not limited to pregnancy, hormonal therapy, birth control. Other medical treatment that can trigger hormonal changes are also a cause of melasma. Some skincare products with aggressive formulas that are too strong can trigger melasma. Some medical conditions can trigger melasma. Sun exposure, UV exposure, blue light exposure, and heat. Now let's talk about treatment. How to treat melasma. Before I get into treatment options for melasma, I want to emphasize that it is highly required that there's an adjustment in your lifestyle when dealing with melasma. Because if you're treating melasma and you haven't eliminated the triggers or reduced what's triggering your melasma, you're just going in circle because you're treating and it's going to keep coming back. When I say an adjustment in lifestyle is required, I'm talking about your sun exposure, your heat exposure, whatever birth control you're using. If you're lucky, if your melasma came as a result of pregnancy, chances are the melasma is going to go by itself after your pregnancy, but that's if you're not dealing with other hormonal issues. If you have other form of hormonal changes, you're using medications that causes your hormones to have some fluctuations, you're using other medication treating other medical issues that can exacerbate your melasma, then you want to think about having a conversation with your OBGYN and communicating whatever medication you're taking with your dermatologist, because some of these medications that help to manage your hormonal imbalance can trigger melasma. Let's get right into the treatment options. Now, for the treatment options, I'm going to leave some links in the description box that can direct you to, places where you can get treatment without insurance needed. The first treatment for melasma, which is the gold standard, is hydroquinone. Now, before you run away, I know a lot of people are afraid of hydroquinone. This is not my favorite treatment option, but it is the gold standard. Hydroquinone is not a bleaching ingredient. I know it is commonly associated with a bleaching ingredient or a skin lightening ingredient. Hydroquinone is an ingredient that stops or minimizes the production of melanin in your skin. So it alters the melanin production in your skin, which is why it is usually used to treat any form of discoloration, hyperpigmentation, or melasma. However, this is something you cannot use on a prolonged time. You cannot use it without supervision of a dermatologist in the United States. It is no longer available over the counter. If you go over the counter and you find hydroquinone, please don't buy it. There is a reason why it is highly regulated by a professional like a dermatologist. Even I, as an esthetician, I am not allowed to prescribe hydroquinone to any of my clients. I'm going to put a link in the description box where you can have an online consultation with a dermatologist. No insurance required. You probably will pay between $5 to $20 for consultation, and you will be prescribed appropriate dose of hydroquinone. However, you cannot take hydroquinone if you're pregnant. I do not like hydroquinone for skin of color because I feel like it causes hyperpigmentation. Hyperpigmentation is excessive loss of pigment in the skin when your skin is having white spots or white patches all over the skin, and we know that doesn't look pretty. So I do not recommend hydroquinone, but it is the gold standard. If you have a good dermatologist that is attentive and is going to supervise your usage, I think it's a great option, especially if you do not have skin of color, you do not have risk of that hyperpigmentation. Prescription retinoid is the gold standard when it comes to turning over your cells, and the more cells you turn over, the lighter the pigments appear. But you have to use this in combination with other treatment. Retinoid alone will not help you clear melasma. A blend of 3 to 5 tyrosinase inhibitors. This is my favorite way to treat melasma, and this is how I have been treating melasma. Now, I do love to use tyrosinase inhibitors with retinoid. So having retinoid with either tranexamic acid, glutathione, vitamin C, or even kojic acid or MSM, this is a game changer when it comes to treating all forms of hyperpigmentation. Using 3 to 5 tyrosinase inhibitors with retinoid for me is the best form of treating melasma. Yeah, when you go into the description box, look for a link that says chiral or apostrophe. Either of those links will be able to give you a formula that includes retinoids, but also include tranexamic acid, vitamin C, glutathione, even azelaic acid. Those 5 together in one cream, they are my favorite way to treat melasma. But don't forget that while you're using all this treatment, you must eliminate your triggers, you must reduce your exposure to your triggers, and that's the only way to make sure this is not coming back. The number 4 treatment options for treating melasma is getting routine chemical peel. Now, I'm not talking about the intense chemical peel that your skin is falling out, no. Using a medium strength chemical peel routinely, maybe every 3 months or every 6 weeks, is the best way to get that result, because when you're using medium strength chemical peel, you're not damaging your skin barrier, so there's less inflammation in the picture, and the less inflammation, the less irritation you have, the better results you will get. So I'm not a fan of the strong high strength chemical peel that falls out your face. If you're not dealing with deep fine lines and wrinkles, deep indentation on your skin, I don't recommend the strong chemical peels. I recommend a light to medium chemical peel, because you can do that frequently without causing much inflammation or damage to your skin. So look for a skincare professional like myself and talk about the right chemical peel, the right formulation, the right choice of acid for your skin type, for your skin concerns, and do that routinely. And I can guarantee you, if you're consistent with this routine chemical peel, you're using the tretinoin with other pigment inhibitors, and you're staying away from your triggers, I'm pretty sure you will have a result within a year. Let me emphasize that when it comes to treating melasma, you don't want to pick just one treatment option to treat it. You want to use at least 3 to 4 options of treatment to make sure you're treating it, you're attacking it from multiple angles. Look for something you can use in the daytime, something you can use in the nighttime. What are you doing every quarter? What are you doing every month to make sure that you're treating it, you're attacking it, and it is not coming back? Last but not the least treatment option for melasma is UV protection. When I say UV protection, I'm not just talking about sunscreen. I'm talking about mineral sunscreen, physical sun guards, and maybe chemical sunscreen. Now, I do not like chemical sunscreen because research have shown that chemical sunscreen works by converting heat. There's so many research that have shown that chemical sunscreen works by converting UV exposure to heat and getting it out through sweat. Now, I'm not sure how true that is, but I've read over 10 researches that have said chemical sunscreen work by converting UV to heat. And if you're dealing with melasma, the last thing you need is heat on your skin. Heat conversion, anything heat is a no-no when you're dealing with melasma. So it is safe to say that using a mineral sunscreen is a safe spot when it comes to treating melasma. I'm not saying do not use chemical sunscreen, but I'm just saying using mineral sunscreen is a much better option if you're dealing with melasma. I also want to say using a tinted sunscreen is highly, highly important if you're dealing with melasma. You cannot be using an untinted sunscreen except you're comfortable wearing foundation on a daily basis. So if you don't want to use a tinted sunscreen, you can use a non-tinted sunscreen, but look for a skin tint, a foundation, anything with high amount of iron oxide, because iron oxide is one of the best when it comes to protecting your skin from blue light. If you're someone that is in front of the computer all day, you know that you're getting a high amount of blue light exposure, and therefore you do need that iron oxide in your daily routine. Also using physical sun guards like your hat, your large hat, your visors, your huge sunglasses, your scarves, anything that can help you physically guard your skin from sun exposure, from sunlight, from heat. please get it into your routine and be consistent with it. If you got any value from this video, please give it a thumbs up, leave an emoji in the description box so I know you saw this video. Share this video with someone who you know can benefit from it, and I will see you in my next video. Bye guys. Mwah.